We're still recording. So we can leave.
Oh, I'm going to stay here.
Alright, how's everybody doing today? My name is Ryan, and today I wanted to take some time to inform you guys about autism. This here is the Autism Awareness sticker. A lot of people you might see have this on the back of their car. By the end of my speech, I would like you guys to gain an understanding of what autism is. The common signs, causes, diagnosis, and treatment. Today in America, there's 1 in 88 children are affected by autism and its difficulties that child face. Autism is the fastest growing serious developmental disability in the U.S. First few things I want to go over. First, the common signs of autism. Next, the causes. Then the diagnosis, and finally the treatment. Most of the information I'm going to share with you guys today came from researching the National Institute of Disorders and Strokes, the Autism Statistics and Personal Experience. By personal experience, this right here is what I'm talking about. I have 3 cousins, Aiden, Elijah, and Elliot, and all 3 of them are diagnosed with autism. First thing I want to get at is the common signs of autism. Babies with autism tend to be unresponsive to people. They focus intently on one item longer than others. Children may fail to respond to their names and avoid eye contact. And they have difficulty identifying tone and facial expressions in your movement and how you're acting around them. And now that we've have an idea of the common signs to look for, let's focus on causes of ASD and how where you're living may play a part. That's right, where you're living may play a part. I also want to go over possible causes of autism that are being tossed around by scientists. Our genetic environment. So obviously your genetics play a role, such as you may have a genetic strand in you that you didn't know about, and your child may have gained that strand. But your environment also plays a role. If you see right here on this little chart, places such as Utah has 1 in 156 children, and this is growing. The U.S. average, this is a little older, but it's 126 children have it. Okay, so West Virginia, 1 of 160. North Carolina, 1 of 127. This gives you an idea of where you may be living may have an effect. There's serotonin levels in the brain that the child may have had issues with during development. And twins, believe it or not, if one twin has this, such as my cousins, there's a 90% chance that the other twins could have it. So, after getting an idea that we have looked at the cause and sign, let's turn to our attention to diagnosis. These are ways that a doctor, even a mother or father, could see that a child may possibly have autism. Negative, they're not babbling or making words by a year old. No words by 16 months, or no 2-word phrases by 2 years old. Excessive aligning of toys, meaning that they'll set their toys out in a straight line and not really play with them, but they'll continue to do it even if you put them away. No smiling or social responsiveness. So when you go, here's my baby, blah, 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 that baby may not respond, may turn away from you, may not make eye contact with you. So I hope you guys are gaining good knowledge from this speech. I have one more topic I would like to talk about with you, and that is what the professionals are doing to help treat this serious disorder. Treatment for autism, keep in mind there is no cure. There's educational and behavior interventions, such as you could have people come to your house, they can have your child play with blocks, trying to align them and put them in the proper places. I've seen it done with my cousins. They've turned around really well. They're doing really well. There's medications used such as depression and anxiety. Those are all other symptoms that may come in effect with a child with autism. And there's other therapies, bringing your child around other kids, allowing them to play and interact with other kids. Again, there's no cure, but there is ways to help your child. So as you see, there are plenty of ways to help your child with this disorder. And I hope that you have all gained some kind of information from me today. So let's go over what I covered. The common signs of autism, the causes, the diagnosis, and the treatment. So I hope that you have all learned and understand that this is a real issue in America with our children, and allow me to state that 1.5 million people are affected by this disorder. That's it. Thank you.